Okay, if you're just joining us, this is part 2 of a little series Jill and I are doing. I wanted Jill to be here to help me talk about endometriosis because she not only has a personal journey with the condition, but she is an excellent pelvic health physiotherapist that treats many women and men with endometriosis. So we've been talking in the first session a little bit about how would someone even come to know that they have endo? What's the typical chain of events that kind of is set off after they see their family doctor? What types of things tend to happen as they're trying to sort out whether or not they actually have this condition? And that it often is a really long process for women to find answers. And so what I wanted to really touch on this half of the interview is what Jill has learned along the way with her own journey. And now that she's kind of seeing it from the outside, what she would suggest to her clients or to anyone listening. And again, what I said in the first session about Jill, I love that she's always putting light on this subject instead of making it feel like it's the end of the world for clients. So let's get into that, Jill. And if you don't mind talking a little bit about, let's kind of review a little bit and explain what you would suggest that when women suspect they have endometriosis, again, I stumble on that word every time, when they suspect they have it or they've been told that endo, I know, but I feel like I go back and forth. Anyway, I want you to talk a little bit about what they should do right from the beginning.
Okay. So if we went over the symptoms. So if you haven't seen the first part, watch that first. And then what I would do is maybe go to your GP and say, I'm wondering if I do, or my daughter has endometriosis because of these symptoms. And I'm wondering, can I please get a referral to a specialist? And then you have the list of the specialists, which we're going to give you some resources. And you pick one or two and say, can you refer me to one of these people? And I think that's the easiest way to go about it. And we kind of have to be a little proactive in our medical journey. And I've learned from myself and from my patients. And so, you know what, there's no harm in suggesting it.
And that's a thing that I always tell my clients. And I've been through things in my past with my medical history too, that I had to advocate for myself and I felt so uncomfortable. But what I think women have to understand is that there's no way your GP can know everything, and that's okay. And if they can't be an expert in everything. And if endo is not their thing, then you might have to be the one that's guiding them a little bit, and that's okay, right?
Yeah, absolutely. And in Canada, like it takes about a year and a half to get with a specialist. So up here, there are luckily a lot of other things that we can do in the meantime. And pelvic PT is one of them. Seeing you or myself or many of the other amazing therapists that we have here, because the pelvic floor very much is a reactionary area. The muscles in the pelvic floor react a lot to emotion and to pain, and they will tighten up even more. So you might find that you're starting to have pain with intercourse. Pain with initial penetration is usually the muscles. Pain with deeper intercourse may be the lack of mobility around the cervix. And that can be another indicator that perhaps it's because of these endometrial tissues lying in there. But pelvic floor physiotherapy can be a great place to get you started. Osteopathy is another place that can help mobilize the tissue and get you more comfortable. It's not obviously getting rid of any endometriosis, but it's been a game changer for my symptoms, and that's why I wanted to go into that area as well.
But explain that. I want to explain that, and I'm just gonna because we talked about this in our last session, and the reason that Jill kind of explained last time, and how this is how I met Jill, is I met her at a course where we were learning different visceral techniques and how to mobilize some of the tissues and organs that live in and around our pelvis. And so how we were kind of describing it is that our body's filled with all these cobweb type tissue called fascia, and everything needs to move. And when you have endometrial tissues, everything tends to kind of bind up, and you can either feel a lack of mobility or you might feel pain associated with that. And so the osteopathic techniques or other therapists that work on the visceral mobility can help to kind of unwind those cobwebs and make the more comfort, correct?
It makes a big difference.
Yeah.
I use it all the time. And the good thing about us as pelvic physios doing it, we can use internal and external techniques, whereas osteopaths here in Canada can't do internal evaluations. I think they can, I believe they can in the States, but anyway, so that's really helpful actually.
Yes.
And lifestyle changes is another big one. Am I getting ahead of our questions?
No, I really wanted you to talk about what, like you were talking about, what things people can do in the meantime, because this isn't just going to end as soon as they see the specialist. This is going to be stuff that they use for the rest of their life. So this is all relevant. Yeah. I just want you to talk about what they can do.
Yeah. So a big one that no one ever talked to me about was, and it probably wasn't until I took the level 3 course here in Canada with Pelvic Health Solutions, which goes into chronic pain and chronic pelvic pain, and how there's a mind-body connection, and massive influence on symptoms. I had been kind of doing it before I took that course, but I think I put more emphasis on it afterwards, realizing that there was a connection. So what that means is, if we look at some of the things that help calm our nervous system, the things that have been proven are walking in nature, yoga, calming yoga. It can't be like power yoga, mindfulness, meditation. Now meditation, my brain is like, whoop, 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 whoop. So I found it that's like saying I want to run a marathon and then trying to run the marathon. Just like, be patient with yourself and realize there's got to be some training involved with running the marathon. So that's the biggest thing I had to do, was just not judge myself constantly. And I needed guided meditation. So I downloaded the Headspace app, and I love it. Mm-hmm. There's a lot of apps out there, Insight Timer, and we'll write down a bunch of resources, Calm app and that sort of thing, that have guided meditations. And I needed that in the beginning. And then they have packages sometimes, like on anxiety or depression or pain or whatever, sleep, if sleep is your thing too. So it's good to calm the nervous system. And exercise is really important. And you probably, sometimes I respect my body though. Like I remember trying to go for a run and train for a race, and everything about me that day was just like, don't run. And I realized, okay, I'm just going to take my earbuds out and I'm going to walk and listen to the birds. And I was doing mindfulness in nature. That's what it was. Mm-hmm. And I just felt so much more at peace. And when I started to track, I realized that after I ovulated, I started to be, I was anxious leading up to my period, but that's because for 10 years, mm-hmm. I was trying to get pregnant. And so my body learned to get anxious. Mm-hmm. And so even though I wasn't trying to get pregnant anymore, I'm having to like kind of manage that anxiety in the second half of my cycle, and just respect that I need to do more calming things in the second half of my cycle. It's super interesting. But all of that has made a massive difference, what I eat. So the one thing that made a difference for me to get pregnant, because we had eggs on hold, or embryos frozen for a long time, my lining wouldn't thicken, and I went on an anti-inflammatory diet. And right away, within like 2.5 weeks, I had been trying for 1.5 years. She had me on estrogen. She had me on Viagra at one point, to try and increase the blood circulation to my uterus. And she said, I don't know what you're doing, but your lining is thickening. And I was like, I think it's the gluten. And I didn't have a lot of digestive issues, mm-hmm. but I have to say, I can tell now when I do eat too much gluten or do eat too much dairy or have too much wine, that I'll get I'll get pain. I'll
Mhm.
get menstrual pain.
Mhm.
I mean, I can tell in my body even before I get the menstrual pain. It's pretty interesting when you clean up your diet and your
Yeah,
lifestyle, how sensitive it is to that.
absolutely. And I find that, and I'm sure you see this all the time, that you have to, I find I have to be careful with suggesting all this, because when people suggest all these options to me, I'm like, oh, I can't do all that. Like, I
Oh,
can't change I can't take out
no,
dairy and gluten and start meditating and stop running. Like, it's just like, piss off. Do you know what I mean? But
absolutely.
I find that for myself, if I added all of that, I don't think I would know what's working, and I want to know what's working. So I don't know if you
Yeah.
do this, but I tend to say, you know
Mhm.
what, these are some things that women or myself have found helpful. What, think of all of them, and which one do you think that you could change? Because it's almost like, you know what, and then don't think of this for your whole life. Let's just try it for 2 weeks or something like that.
Absolutely.
And let's just see, because your brain or your body might really, really like that change, and that will make you want to do it more. And so I know you do that, but that's one thing that I find, like, right away I was shutting down when people would suggest, and my problem wasn't endo, it was fertility and losses, but it was the same type of thing, is that my body was just like amped up, my nervous system was amped up, and I couldn't keep a pregnancy. And so I think there's something to be said about that, is don't crash the body with too many changes
Oh
either.
my gosh,
Yeah.
I 100% agree. And you know what made me do the dietary changes was the tens of hundreds of thousands of dollars that we spent on fertility. I was like, what the
Exactly.
hell?
Exactly.
It's going to cost me
Yeah.
nothing. But
Exactly.
it is true. It can 100% be, it can be overwhelming. And I made these changes over years.
Yes. Yes.
It was not overnight. And I love the way you just put that, laying out all the things that can make a big difference. What do you think you could start with? What's doable?
Yeah.
I'm 100%.
Yeah.
I agree. Yeah, it's important. I'm glad you brought that up actually.
Yeah. And
That is,
and I find that the one of the biggest hurdles for women, and meditation and mindfulness has had to be part of my life ever since then, to varying degrees. But I find that as soon as you suggest meditation and mindfulness, again, people are like, this is not in my head, Melissa. Like, I don't just need to meditate it away, but I think, like, I would say that I love your point about talking about the nervous system a little bit more. It's not in your head. You're not imagining it.
no.
Just thinking it away is not going to make it go away. It's just what happens is that tissue is an irritation to your body and an irritation to your brain, and your brain remembers that. Like you said, it'd be like having, I think you used this example with me one time, it's like having a thorn in your foot all day. It starts to become really, really bothersome, and then all of a sudden you have a headache, or all of a sudden you just feel angry. And
Yeah.
unless you take that out, it's not necessarily going to go away. But even if you take it out, you might notice that your foot still bothers you, because your brain's so used to paying attention to it. So all the mindfulness and meditation, what it does is it just allows that dialed up, cranked up nervous system time to just calm down, and often that will help address the pain. So I think that's such a good one. But I do find that I have to be careful with how I bring that up to my clients, otherwise I create that,
Yeah.
fine, this isn't right for me. So yeah, I find it, you have to really read your clients, right?
One point that you just made was like, if they take the thorn out. So let's say they have excision therapy, and you'll see, like, I don't suggest people go on the support groups because they can be quite catastrophizing, but um I'll read them, and a lot of times they will get the surgery and they still have the pain, and they feel like the doctor missed stuff. And this goes to your point exactly. By the time they get there, their system is so amped up. Plus, people are poking and prodding and all of this, and it it is about calming the nervous system at that point. And I mean, not just at that point, anytime leading up to it will make that surgery that much easier to recover from afterwards. It makes a big difference. But you're right, like, you need to figure out how to, I start people with mindfulness. I find it's an easier one to go to. So even just if they're going for a walk, I kind of get them to tap into the senses and say like 5 things that you see, 4 things that you hear, 3 different things that you smell, 2 different things that you feel, and 1 thing that you might taste, like the coffee on your breath or that you had in the morning. But because that helps us eliminate a lot of the distraction in our mind, and it focuses us, which calms our nervous system. And so that mindfulness is an active meditation versus a passive meditation, which is more of the trying to clear the mind, which in our society is very, very challenging to do. So I find starting with mindfulness is almost a little bit more doable. Like if you're washing dishes, or you just pick one activity and focus on it.
Yep, because I bet you find then what you can take this to is I see so many women that come in and they have cyclical pain, and they start with, just help me take the pain away. And sometimes I do do some manual therapy that helps, like, just give them a sense that it can feel better, right? Because I feel like that's powerful. But then I always say, like, just me alone is not going to be able to take away this pain. I want you to start working through it. Usually I teach them a lot of breathing exercises and think about like opening that area down there, right? And just trying to think about making space in those cobwebs essentially. But then I always make sure that they work through, okay, your pain's coming. What does that feel like? And they've learned, I've taught them how to kind of release their pelvic floor muscles, which is where a lot of them feel pain. But they start to, I say, you know how to relax and take away that tension because you've worked on it. So now start noticing when you have pain. Do you notice how you feel tense? Okay, well, you know what to do about that now, right? And so they start to be able to say, oh, like I do have a tool here. And that's where the mindfulness comes in, is they can sense that. Where is my pain? Where do I feel my tension? Okay, I actually know how to deal with this. And all of a sudden it takes off so much of that dark cloud because they have some of their own tools or some of their own power over it, right?
Yeah, absolutely. I think they feel very much out of control of that when they're seeing a bunch of doctors and they're all saying different things and they're still having the pain's getting worse, and they feel like this is getting out of control. So if they have tools like that, it very much gives them a sense like, I can do something. I feel a lot better when I do it. Yeah. It's practice, but.
And this is stuff that who else besides, let's say someone didn't have this is something that a lot of pelvic health physiotherapists work with. So we're not saying that you have to totally figure this out on your own. These are some techniques, but don't be surprised if you need a little bit of help, a little bit of guidance. That's what we do. Who else, Jill? Like, is there any other professionals that would be that you would suggest? I mean, obviously we talked about the osteopaths for some visceral mobility.
Well, even yoga, like Shelley Prosco has some great videos online. Shelley Prosco is another PT in Alberta.
She's Canadian. Yeah, she's in Alberta. Yeah.
And she has some online videos. I like them because of the cueing she uses with the breathing. Yoga usually talks about breathing and everything, but she uses it with the pelvic floor and the pelvis and movement. You don't fear movement. You don't feel immobilized during, a lot of women just go to bed. And so if you can have some tools while you feel not so bad to use movement as therapy, then that can be really, really, really therapeutic. And she's online. She's got some great videos. We'll put her in our
notes. We'll put her in the notes. Who else? What other things? Any other things, people that don't have access, maybe they live in a small community, they don't have access to going in to see someone. I'm just trying to think of other resources.
So there's an app. There's an app called the Curable Health App. Have you heard of that? Have I told you about that?
No, Curable Health.
So it's a great app. You have to pay for it, but they just started at the beginning of this year addressing pelvic pain. And so there are some stories on their podcast, which is called Like Mind, Like Body. And they use a mind-body approach, and it's all evidence-based, and so if you are in a lot of pain, the Curable Health app can be a great resource for that. I'm hoping to design an online
I was just saying, I keep telling Jill, you need to make an online program, because I have so many people that I'm like, I wish Jill had a program, but it's so nice to have like these online programs. I don't believe that they can replace seeing someone all the time, but they can definitely give you so many things to work through, so that when you do go see a professional, you're like, I've already worked through a lot of this. Let's just fine tune this.
Yeah.
Where would you suggest? I would say most people, and I was one of them, to make any diet changes, like that can be intimidating for people. Like, what does that look like, and where should they get help for that?
I mean, if you are in remote areas, there's a lot of free information, but at the same time, you have to kind of,
I know,
right? You have to be careful. But an anti-inflammatory diet is an anti-inflammatory diet. So really, you can do quite a lot of it on your own. So, but if you need and want some guidance, which is always nice, then you could see a holistic nutritionist or a naturopath. And the naturopath is a good idea because they will address the hormone side of things too. Exactly. So they can guide you on that side of things, and maybe just make sure that naturopath is familiar with endometriosis.
I was gonna say, that's just the same. Like we were talking a little bit about this. Like, we're both pelvic health physiotherapists, and we see a lot of the same clients, but I would say Jill probably attracts a lot more people that have pain. I tend to attract a lot more pregnant and postpartum women. That's not all we see, but you tend to kind of get specialized in your area. That's just who you draw. And so naturopaths, osteopaths, massage therapists, all the same. They tend to have an area that they treat the most. And so that's what she means by finding someone that really sees a lot of clients with endometriosis. Mm-hmm. Okay.
Acupuncture can be helpful too.
Yes, acupuncture. Absolutely.
I found acupuncture quite helpful in, like I did it for fertility. I'm pretty sure he was just doing it to calm my nervous system. Totally. I didn't care. Mm-hmm. I just felt great coming out of there. I did feel more relaxed. That's a big part of it. I mean, I didn't put any thought into it. I just did it, and I could barely understand him. He was a doctor in China, and he's really well known for treating women with endometriosis and fertility issues. And I just succumbed to him taking care of me, and there's something to be said about that as well.
Absolutely. And that's the thing. I think that would be a really good take home that everybody can work on at home, is just find ways that you can calm yourself and calm your nervous system, because that always helps with pain. No matter what you have pain from, that is going to be one of your number one things to deal with pain.
Yeah.
What else, Jill? Is there anything else that I haven't?
One thing I will mention that also doesn't get talked about a lot is xenoestrogens. Okay. So the things in our makeup and our cleaners, in our shampoo, in our soaps that mimic estrogen, and as endo is an estrogen dominant and estrogen dependent disease, you want to make sure that you are managing as much, control the controllables. So like I make my own lotion, and I know I'm a bit of a hippie, but you can get a ton of this stuff. Makeup, I make sure I try and get stuff that is like I use Beauty Counter. I'm probably not supposed to be giving names, but there's other names out there of cleaner makeups and lotions and soaps and shampoo and cleaning stuff for your house. Like really go back to vinegar and baking soda, and because a lot of them have a lot of xenoestrogens in them. And then also food storage bins, getting rid of the plastic and going towards glass, that can make a big difference too. And then just using like plants in your house that are filtering and drinking cleaner water if you can. I want to get a filter. I need to get a filter. Because there's like everybody, people who are having the pill and then peeing and then it goes out into the lake and it comes back. That doesn't get filtered.
Right.
So we need to be cognizant of that stuff.
And that's another thing too, that when I hear all the things that need to be changed, when I heard that first 50 years ago, I was like, too many life changes, right? But I would say, like, my husband and I sat down and we're like, hey, what can we change this month? And then we would,
Yeah.
you know what I mean? Because otherwise it's like overwhelming and it's expensive to make all those changes. And even though you know that you should, it's all of a sudden like, okay, now I got to do this, this, and this, and this. But just plug away, make yourself a list and plug away at what you're going to slowly change. And next
Yeah.
thing you
When you
know,
run out of your shampoo,
yeah,
like
buy a
look up
different
a
one.
cleaner
Yeah,
version of it. Yeah.
yeah, exactly, exactly. And that's, again, that's
It
what I
takes
love.
time.
That's what I love about your spin, is always that, like, they're doable things. And you know, it takes so much of the reliance off of, I have to go get a diagnosis to take this out and then I'm clean. Because it's like anything, if you don't look at the big picture and deal with all of the issues, you might find that you are waiting for a diagnosis for so many years. I tell my clients this: you're going to wait for a diagnosis for a long time. You might find your diagnosis is a bit gray and you might not be given any solutions.
Yeah.
So without that sounding scary, let's start talking about that now, so that you are kind of working through the process. And let's hope in the meantime your symptoms change, right? And you start feeling better. But then things aren't such a, oh my gosh, now I have nothing to do. You know, you've got so many things you can do. And so I think that's important. Yeah.
Yeah.
Well, I appreciate you doing this, Jill. We'll talk and get together some good resources that we can put in the notes. And I am probably going to turn this interview into a blog post so that people can have a written summary of this too. Jill, tell us where, because you have so many good resources too. So tell us a little bit about where we can find you. If anyone has any questions, how could they ask them of you? Yeah, where can we get more information?
So yeah, if you're in Ontario, I'm in Oakville, Ontario, at Healthy Balance Physiotherapy and Wellness. The email is www.hbpw.ca. I also have a personal website, which is jillmueller.ca, which I have written a few blogs on endometriosis as well. And if you want to email me, I don't mind. I can be reached at pelvicphysio@icloud.com.
Okay. And we'll put all that in the notes so people can find you. But I appreciate you taking the time to do this.
Oh,
We
it's
both
fun.
have to go to the clinic today, right?
Yeah.
You have to go work. Yeah, I have to go work too. So, yeah. Anyways, I appreciate this, Jill, and we will connect again soon.
Awesome.
Okay?
Thanks, Melissa.